In this video, we will introduce some basic concepts about a very interesting hypersensitivity called Goodpasture syndrome. Dr. Goodpasture, born in 1886, was a prominent American pathologist and physician who advanced the scientific community of his time during and after the great influenza epidemic of 1918. He invented methods of growing viruses and rickettsia in chicken embryos and fertilized eggs, paving the way for the development of many vaccines. While studying and treating patients of infectious disease at Vanderbilt University in Nashville, Tennessee, he and his colleagues noticed that some patients presented differently than the ones who were afflicted and died of influenza. Currently, in the medical fields, we know Dr. Goodpasture as the discoverer of a syndrome that carries his name and demonstrates very interesting pathology. As a pathologist, he observed that some of the patients died with the discovery of pulmonary hemorrhaging at autopsy. Dr. Goodpasture observed unusual inflammation in alveoli with hemorrhaging. However, inconsistent with influenza and other pulmonary infectious diseases, these patients also were discovered to have renal disease. Let's focus at the glomerular basement membrane with podocytes. This is the region of inflammation and pathology of the glomerular basement membrane. FYI, this is a light micrograph section of a normal glomerulus encased in Bowman's capsule. FYI, pathology slides of the nephrons of patients with advanced Goodpasture syndrome would demonstrate crescentic glomerulonephritis with regions of necrosis and crescentic formation. What is a basement membrane? It is a thin, pliable sheet of extracellular matrix that provides tissue support, acting like a permeable platform that allows biomolecules to move between layers of endothelium, mesothelium, and connective tissue. Let's look closer at the Bowman's capsule of the nephron at the glomerular basement membrane of the arterioles with podocytes. In Goodpasture syndrome, autoantibodies attack the basement membrane, attracting complement fixation, and the complement cascade, neutrophil infiltration, inflammation, and pus formation follows. The specific autoantibody in Goodpasture syndrome attacks alveolar and glomerular basement membrane antigens. For your information only, this autoantibody attacks type 4 collagen factor alpha 3. What lab tests might be useful to screen or monitor a patient with Goodpasture syndrome? Renal function tests, acute phase reactants to monitor inflammation, CBC to screen for iron deficiency anemia if there's significant pulmonary hemorrhaging, SED rate to monitor inflammation, urinalysis to check for signs of glomerular nephritis. And what test results would you predict for a patient with Goodpasture syndrome? Specific tests are the ELISA and fluorescent microbead immunoassays to detect and monitor the level of anti-glomerular basement membrane autoantibody. For your information only, pathology studies include biopsies of the lung and kidneys to obtain a pathological diagnosis. Iron studies could be helpful to detect iron laden alveolar macrophages. A specific diagnostic test is the direct immunofluorescence on biopsy specimens using fluorophore conjugated monoclonal reagent antibodies that are anti IgG.